I mediated, facilitated a panel with the podcast party, Unplugged. Unplugged? Was it Unplugged? Democracy Unplugged. My apologies. Democracy Unplugged. Podcast party. And I had different representatives of different political parties sitting there. And there was a video played, pre-recorded by one of the leaders of Action SA, where the DA there, I think we had someone that wasn't representing the ANC, but had worked with the ANC. And then we had a gentleman from the private sector. White, black people that were there. Male, female as well. And there was an audience. And we had a conversation. It can be found on the Podcast Party SA YouTube channel. But one of the questions I've been asked, Pen, what do you think of the NHI, the National Health Insurance? It used to be a bill. It's an act now. It's not a bill anymore. It's been made law. I don't want to go too hard. I had the privilege of sitting with Ntate, Padi, Lihutla, the ex-statistician general. He quoted recent numbers. 71% of white people in South Africa are under medical aid and use private healthcare. 71%. 9% of black people have medical aid and are under private healthcare. Now, legacies of apartheid, definitely. Socioeconomic factors, of course. A woeful education system, definitely. The solution that the ANC government came up with, today we call it the GNU, with the DA and others, is NHI, trying to copy Obamacare. This thing that everyone will be included. Now, outside of the data that I gave you, roughly 10% of our population has access to private healthcare and medical aid. 10%. The other 90%, understand 10% is 6.3 million. The other 90%, over 50 million people, maybe over 55 million people, rely on public clinics, public hospitals. And what government has decided to do is to bring all of these under one umbrella. And it's still tricky how they explain it, by the way. Because people are like, oh, private hospitals won't exist anymore. No, they will. What government is doing is this. You as an ordinary citizen, 90% that can't afford, will be able to use private healthcare, practices, clinics, hospitals, and then they'll bill government. For me, the easiest way to explain it is NSFAS. They're going to have this fund, the National Health Insurance, where the poor child who can't afford to go to UCT gets paid for by government. So you're like, oh, so government is going to pay for poor people to go into the, oh, done. Hey, unfortunately, it's not done. Because that's not actually what they're doing. Outside of obviously the privileged being annoyed, no, we can't be sitting with these people, they're going to crowd our, sure, whatever. The budget of private healthcare, your discoveries, your gems, all these medical aids that are out there, schemes, and the private mediclinics, and all these private hospitals, the money that they make a year is almost comparable to the budget of health from government. 90% of the population relies on a budget that is the equivalent of the budget of 10% of the population. The 10%, of course, is people paying their medical aid, people paying out of pocket. Very expensive. But 90% budget is the same as 10%. And government saying, no, Yazin, so what we're going to do is we're going to dip here in this money here. And that's where people that pay medical aid and the medical aid schemes, and they're like, fuck that. So we've built these businesses and you guys want to dip here to supplement here. That's bullshit. Now, elite people have got their problems. They've got their arrogance. They've got their racism, which of course we need to address and resolve. Not here. Not here. Our government has failed to fix and upgrade public healthcare, which serves 90% of the people. And instead of taking accountability and trying to figure out how to fix this, they want to come and mess with the private sector. This is the equivalent of government saying, our education is so shit, So what we're going to do is we're going to take some of the money from private schools to pay for kids here in public schools that we fucked up to go and study at private schools. That's my understanding. Other people obviously correct me because, like I said, the way it gets explained, many people are still not sure of what's going on. Our government refuses to take accountability for their fuck-ups and to try and fix their fuck-ups. And if they cannot fix them, to move out of the way. To be like, hey, you know what? We tried and failed. Administration is horrible. Corruption is horrible. Babita was murdered for blowing the whistle on corruption at the Gauteng Department of Health. People have been linked about Dr. Zweli Mkhize, who at some point was a presidential hopeful. He was the Minister of Health at some point. His son was enjoying tenders under digital vibes. People die in the hospitals. People don't want to be there. People feel like walking into a government hospital or clinic is asking for a death sentence. Those are my thoughts on the NHI Act. Now, when we speak about this is part of my problem. Government is the biggest employer in this country. I think they've got over 1.3 million, maybe, employees, who they pay well, relatively. Government employees are on arguably one of the best medical aid schemes in the country, GEMS. I think it's called the Government Employee Medical Scheme. It's brilliant. It even allows women, I think, to have like breast reduction. Things that are like cosmetic. Why are government employees allowed to use private services? Should they not be the first people to use public? Okay. Should the money that they send to private not be ring-fenced and then brought to public? That's number one. And someone has said before that if you got the middle class and upper middle class to use the poorest public schools and to use the baddest public hospitals and clinics, they will automatically improve. Why? Because those people are going to complain. It's clever blacks. It's white people. It's Indians and coloreds that are better off, that live in suburbia. They will not stand for bullshit in that space. So they will complain. The reason these things are not getting better is because the poorest, most undereducated people are there. They don't know the right channels to complain. They don't know how to hold people to account. So take these private healthcare and medical aid blacks that work for government and force them to use public healthcare and watch what happens. And you could even argue the same with private schools. Why is it that teachers that teach in the public schools get to send their kids to private schools? No, bring them back here. You can't be selling a product to people that you don't want for your own children. No, Baba. Here. That was the first issue. The second issue, which may even be worse, we live in a country where we have allowed politicians, members of parliament, ministers, the president and deputy, the speaker of parliament, the premier of provinces, the MECs in the provinces, the mayors, the MMCs in the mayoral offices, the ward councillors and the like. We live in a country that allows politicians to buy shares in companies that compete with the work they're meant to do. Why is it that MPs can buy shares in private healthcare, in Discovery, in Mediclinic, but they're meant to fix public? Just take a moment to think about it. I've got, let's say, for example, 100,000 Rand invested in Discovery, Mediclinic, and the like. I would like that share portfolio to go up. I'd like more people to sign up. I'd like it to make more profit so I can become richer. But at the same time, I work in a space where I'm meant to be fixing public healthcare. Do you know that if I fix public healthcare, people are going to leave medical aid and they're going to leave private hospitals and they're going to jump here? Which means what? It means my share portfolio goes down in value. It's called a conflict of interest. How is it that politicians are allowed to have shares in companies that are competing with government work? You have shares in Curo, it's owned by Stadio. You have shares in Stadio, but you're meant to be fixing public education. You have shares in PEP, or in whichever companies own Aramax and these courier companies. You have shares there, but you're meant to be looking after the post office, which has been destroyed, because you want your share portfolio to go up in these courier businesses that are private, and you've destroyed these public goods. Someone somewhere needs to at some point put their foot down and say, there is no government employee that is going to send their kids to private schools. You will send your kids to public schools. And if anything, you want to send your kids to the average public school so that you guys can bump up your service. No government employee is allowed to use private healthcare. You will use public healthcare because we need you guys that serve here to make sure that the service is better so that you and your family can come here. We will not allow you to buy shares in these companies that conflict with the work that we're doing, because we're meant to serve the people and not to be serving our share portfolio. That needs to be resolved. That's my closing on NHI.